The question is, what now in the United States of America? How are we doing? How are our breastfeeding rates? And I'm going to give you data that was just released by the CDC for a cohort of babies who were born in 2004 and followed. This is hot off the press as of maybe 6 or 7 months ago. So how are we doing? So you can see for all women in the United States, our initiation rate was 73.8%. So we're talking about any amount here. So that means 73.8% were giving their babies at least a sip of breast milk when they left the hospital setting right after birth. 41.5 were breastfeeding at 6 months and 20.9 at 12 months. And our goals for Healthy People 210 being 75, 50, 25. And then the CDC published data rates according to racial profile, and you can see that whites and Hispanics breastfeeding at much, much higher rates. And this is what the Surgeon General was referring to when he's talking about we need to do something to address the alarmingly low rates seen among African American women. So 56, 26, and only 11.9 are giving one sip of breast milk at 12 months. So I can now give you exclusivity rates. We've never had this before. So we now know that at 3 months in the United States of America for babies born in 2004, 30.5% were exclusively breastfeeding and 11.3% at 6 months. We never have had that data before. It's the first time we've ever had it. Now you might say, well, what's the big deal? Why did Rita bring us all here if the Healthy People 210 goal is 75 and we're at 73.8? Good for us. Well, you have to remember how we're defining breastfeeding. One sip counts. And let's look at us according to other developed nations. So you can see the Scandinavian countries' initiation rates are very, very high. Germany just published their rates, which are in the 99% range. And they don't count one sip as a breastfeeder. So my point is that our goal was very low. So our 73.8, while it might meet the 75, that's a really low goal. Okay, so I'll let everybody take a guess if you haven't looked yet. What state do you think in the country, Rita, I'll ask you if you haven't looked. What state in the country in 2004 do you think had the highest breastfeeding rate? Anyone that hasn't looked? Anybody? California? Good guess. Okay, here we go. This is data for 2004, how the states did. So Washington came in first, Oregon, Montana, Colorado. Whenever you ask about a public health initiative in the United States, always guess the West Coast. It usually falls, West Coast does the best, then Northeast, then middle of the country, and always coming in dead last are our friends from Louisiana, Mississippi, Alabama, always. So that's how this panned out. This is CDC data. The state I'm from, Massachusetts, 72.4, and then coming in dead last, as usual, was Mississippi, which is very, very sad. All right, so this is rates by geography in our country for 2004. That's one sip counts at birth. Here's the 6-month rate, how are states doing. So again, guess West Coast and you'll be guessing right. Alaska, Washington, Oregon, Utah, and look who snuck into the top 5 here. So Vermont. Vermont starts high rates, but they really go for a long time in Vermont. And then just Massachusetts and actually Louisiana came in last, with Mississippi coming in number 50. And then here are the rates for 12 months, one sip counts. Again, West Coast with Vermont sneaking up there. They go for a long time in Vermont. So I just want to give you this geographic data. Let's look at it on a map view. So this is the same data, looking at it looking for the whole country. So this is one sip counts. We're shooting for 75%. The darker the color, the better. The very dark blue means that they met the Healthy People 210 goal of 75% or more. So as I was saying, West Coast does very well with this, followed usually by the Northeast-ish, then middle of the country. And then you can see Louisiana, Mississippi, Alabama, that their rates are very, very low. That's one sip counts. This is data for 6 months. Again, this is setting the standard low, one sip counts, 6 months. Here's 3-month data. So this is exclusivity, and the picture gets very white here, which means we don't have much of it. So this is how many babies are exclusively breastfeeding at this time period measured, which is 3 months. And you can see it there. And then here's 6 months. Whoa, that's 6-month data. So fortunately for our friends at the CDC and NIH, we've changed the bar, which is great. So here were the conclusions from the CDC for this first cohort of babies reported on by the United States government for 2004. No states met the new 3-month exclusivity goal. No states met the 6-month exclusivity goal. 21 states met the 75% initiation goal. 9 states met the 50% 6-month goal. And 12 states met the 12-month goal with those, and 8 states met this 3 any amount goal. And you can see what those states are, all West Coast states except for Vermont.